Honorable Judge, isn't it clear the company should not make profit from life-saving drugs? Life-saving drugs are medicine to survive. Without it, some people might die and might die. Our team's stance for this debate is simple, that we should ban companies from making profit from life-saving drugs because of many reasons. Now, without further ado, let me move on to our team's first argument. Our team's first argument is that life is more important than money. Judge, imagine that someone who is about to die can't get a shot because he or she doesn't have money. Judge, is this justice? Is money more important than life? Money is to help you live better and to get convenience. However, life is what you live for and why you exist in this world, in the status quo, and in this society. Judge, in other words, we'd like to ask, is convenience and money more greater or the problem of life and death more bigger? We believe that the problem of life and death is much more bigger, and therefore, companies should not make profit from life-saving drugs. In addition, our team's second argument is that it increases inequality. So what do we mean by this? This argument means that the gap between the rich and the poor. Yes? No? Okay. So there will be a huge gap between the rich and poor. So while the rich can afford the life-saving drugs easily, the poor can't. So when the rich lives, the poor dies. So allowing companies to have profit will increase the inequality between the rich and the poor. However, in our world and in our status quo, companies don't make profit. The poor can afford to get the shots that are life-saving. Not allowing companies to make profit will decrease the inequality between the rich and the poor. Let me explain the impact of this argument. So if the inequality gets bigger, the society shakes. The poor and the rich will feel hatred and won't have a good relationship with each other. So justice will disappear, and therefore the future will get damaged and will eventually disappear. So in conclusion, I have presented I have identified the key terms, which was life-saving drugs, and presented our team's first argument. Our team's first argument was that life is more important than money. So, Judge, what we mean by this is that the convenience is much more less important than the problem of life and death. In addition, our team's second argument was that it increases inequality. So what we mean by this, yes.
Don't high-quality drugs from profitable companies help to ensure that lives are saved and the money can be used into better drugs?
This is actually not true, because if the companies if it's like what you said, then companies will only try to make life-saving drugs that makes profit, which will harm the society, as I said, and also it will increase the inequality. So continuing, our team's second argument was that it increases inequality. So the gap between the rich and the poor will enlarge. And if this inequality enlarges, then the poor and the rich won't feel good feelings to each other, because while the poor cannot afford, the rich can afford. So for these reasons above, I'm more than proud to propose. Thank you.
The Honorable Judge highly esteemed opponents. My name is Ming Kai, and I'm speaker number one of the opposition team, and today we are debating on motion of we should ban companies from making a profit on life-saving drugs. We strongly oppose this system. Life-saving drugs are defined as those that are necessary and essential to fight critical illnesses that are basic necessities for human survival. Our argument today will help center around how it's very important to help and support companies that are helping all of mankind in this very important task. Today, we, the opposition, will focus on how profits encourage innovation and how expensive research is. We also discuss how profits attract investors and that government systems can't handle everything. Profits also allow better quality and safety, and we will also address the proposition's concerns about how there can be such rules without banning profit. Let me begin with a rebuttal. We completely agree that life is more important than money, but that is exactly why profit must be allowed. Without profit, there'll be no funding to research, test, and produce the very medicines that save lives. Money is not being placed above life; it is being used to protect it. Pharmaceutical companies need financial resources to pay for their scientists, to buy equipment, and to ensure safety. Profit sustains the entire system. So banning profit may sound moral, but in reality, it will lead to fewer medicines and more lost lives, which is far more unethical. Let's begin in my arguments. Firstly, the proposition has grossly underestimated the costs involved in medicine and drug manufacturing. Pharmaceutical research is expensive. Many drugs fail before they succeed. Pharmaceutical research costs billions of dollars, as companies must fund laboratories, pay scientists, and conduct long clinical trials. Many drugs fail before one succeeds, so companies rely on profits from successful ones to cover their losses. If we take away the profit, many research projects will stop halfway due to lack of funds. Profits are not just rewards, they are what keep the cycle of discovery and testing alive, ensuring new medicines continue reaching patients in need. Moving on, the proposition has also ignored what money can actually bring to the table for these companies. Producing safe and effective medicines requires strict quality checks, skilled professionals, and advanced equipment, all which are costly. Profits allow companies to maintain high safety standards and keep improving their production methods. If companies lose their income, they may cut corners, reduce staff, or lower testing methods. This could lead to dangerous mistakes and unsafe drugs. Profit ensures that companies can continue producing high quality, reliable, and safe medicines for everyone. Is there a price we put on safety? I dare to ask a proposition. We need safe environment for workers, safe drugs, quality machinery. All of these cost money. This is about quality and humane life. We cannot be shoddy and shortcut with stuff like this. In our world, everything is safe and secure. The companies and patients all live with integrity and can keep standards high in both health and in medicine. Therefore, this clearly proves that we should not ban companies from making profits from life-saving drugs. Thank you, ladies and gentlemen.
The leader of opposition has stated an argument of why their team wins this debate, of why companies should keep making a profit for finding life-saving drugs. However, today I will rebut against his argument, moving on to supporting the Prime Minister, and then finally delivering the final arguments of why us, the government team, should win this debate, of why we believe that companies should be banned from making a profit from life-saving drugs. Now, without further ado, let me move on to rebutting against the leader of opposition and his argument of finding a cure is too expensive. So basically, what it states is that it can take millions to billions of dollars to recompensate while finding the cure. He stated that you need to pay the company, you need to pay for the ingredients while finding the cure, and like paying the scientists that also created it. However, this is not true since even if it was turned free, they will still find a way to make money since a government will pay for their losses, even if they made it free. The government working as the system that functions and helps the society. They'll pay for the company for their losses instead of the company setting prices for the life-saving drugs. They can make a deal of maybe every 1,000 pills or shots they'll donate, they'll give this amount of money for further researches, and also paying for the losses, and also paying the scientists. The government will act as thank you, as the payment, and therefore this argument does not stand. And now move on to supporting the Prime Minister in the argument of increasing inequality. It stated that the rich are able to afford for the drugs, so they will be able to live, while the poor won't be able to afford and die. And to support against this, what this argument say is it's basically saying that it's too unfair for the poor to survive. First of all, they're just living on the streets, barely surviving, scavenging for food. And now when they get a disease, the opposition side is saying that they should pay for it, even if they don't have money. So either die or pay for the drug, and this is too unfair. And this gap of the rich and the poor's lives are increasing, and it's too unfair. And now move on to the final argument for the government team, which is the companies will be destroyed. So what this basically means is that the companies, if they don't quickly turn the drugs into like free, like almost no one will like buy from it to like anger and curiosity and from like the backlash from the public, and they don't earn money even if it's like a popular drug. Like this is true from the public backlash from the public. If they find out that if like the poor people aren't able to get it just because they don't have money, they'll protest and have a backlash, and for protest, almost no one will buy, and the company will be destroyed even if they find a perfect drug for like that will save millions of lives. The impact of this is that even if they're like popular product, if almost no one buys, it's almost like basically useless. Since nobody buys, so it won't take into effect, and the company will also won't be able to get any profit. And and but in our side, if we ban the company from making a profit, then if it's free, then everyone will freely use it without any backlash. And then like I mentioned earlier, the government will pay for their losses and from like the taxes that we receive. So at least the company will get some money from the government if they make it free. But the public backlash, if they try to make a profit out of it, will make it almost impossible for them to make a profit. And therefore, I'm proud to propose.
So, honorable judges and esteemed opponents, as speaker number 2 of the opposition team, I am here to prove that we should not ban companies from making a profit from life-saving drugs. Let me start with rebuttals. The proposition mentioned that people are so poor that they are scavenging for food due to poverty. This is a very gullible way of thinking. People who are on the streets and scavenge for food usually are in that position due to drug addiction and other severe behavioral issues, not poverty. Moreover, using poverty again and again as the only argument seems to be the proposition's pattern. Our final speaker will address this by explaining how important it is for the companies to make the profit and how we can still make it all affordable for people from all backgrounds. Pharmaceutical companies invest huge amounts of time, money, and research into developing new medicines. Creating a life-saving drug can take 10 to 15 years and cost millions, sometimes billions of dollars. Without the possibility of earning profit, companies would have no motivation to take such big financial risks or dedicate years to research and testing. The proposition has not calculated just how much it takes to create such drugs. The profits act as a reward for innovation. When companies know they can earn from their success, they are inspired to work harder, think creatively, and find cures faster. So there is a huge advantage. Many of the medicines that save lives today, like insulin, vaccines, and cancer treatments, exist because companies had the financial incentive to research and develop them. How does the proposition address that? Would they have created such drugs without money? If we do what the proposition says, research would slow down. Scientists might not have the funding to buy equipment, conduct experiments, or test drugs safely. Innovation would suffer and fewer new medicines would reach patients. So then lesser patients would survive. Is that what we want? The proposition needs to see that many preventable deaths might continue simply because there was no incentive to invent better cures. This is not a risk that we, the opposition, are willing to take. Moving on to my next argument. It is unrealistic to expect governments to handle everything. If we follow the proposition's suggestion, imagine what would happen. In the proposition's world, governments would have to handle supporting these companies. Governments already struggle with the budgets, healthcare costs, and other national priorities. Expecting them to research, produce, and distribute all life-saving drugs is unrealistic. Private companies bring expertise, speed, and large-scale resources that a government often lacks. They help share the burden, ensuring that new medicines reach the public faster and more efficiently. Why let the government carry a greater burden? Government. That seems to be the only solution for the proposition. Why do we have a private sector then? Profit is not just greed. It is an incentive that pushes companies to innovate and respond quickly to global health needs. Therefore, this proves that we should not ban companies from making a profit from life-saving drugs. Thank you.
Judge, in the status quo, life-saving drugs are still expensive, widening the gap of rich and poor and destroying the economy of the whole society. So, our team believes that companies shouldn't earn profit of life-saving drugs, which will lead to life-saving drugs becoming free. So, as a government whip speaker today, I will present two clashes. Now, moving on to our team's first clash, which is won't money make inequality of life? The opposing team said that profit are necessary in those medical companies, and if there are no profits, there will be less quality of medicines. However, especially medical company, they get supported from the government or the National Health Organization for improvement and better medical quality for them. Since medicine gives crucial effect to the society, then they will still have good quality of medicine getting supported from the government or the health organizations, even though they do not get the profit of life-saving drugs. Even though they do not get supported from the government or the health organization, they also earn other medicines profit. Remember, they're only not getting the profits of life-saving drugs, so they can still earn money of the other medicines, and by this money, they can still make it high-quality medicines.
Here I'm at.
Rejected. However, our team said that money is for living better. However, life is all about living. When poor people doesn't have money and they have severe sickness, they won't be able to buy these expensive life-saving drugs. So, for the society, we should make the life-saving drugs free. But if it doesn't happen, it will make inequality of rich and poor, widening the gap, discriminating and leading to the protest and big effects to the society. Now, moving on to our team's second clash, which is what would everything give effect to the bigger society? The opposing team keeps saying that there will be financial harms and our world will have some less quality things. However, as I mentioned earlier, there won't be any financial harms because they get supported from the government or the National Health Organization. And also, our world has the support. Our team said that when inequality gets bigger and bigger, there will be a really big effect coming up to the bigger and bigger society. When we do not make the life-saving drug free, when inequality gets harder and harder, getting harsher and harsher, people might protest for fairness and equality for the poor, and not only widening the rich and poor gap. Then, Judge, think about it. This would lead to people unliking the specific medical company. And there will be less people that will buy the products and medicines of the specific medical company. Then, when the medical companies will improve the economy really big and give really big effects to the society, when people do not buy any more of the specific medical company's medicine, the economy would collapse, giving big effects to the big whole society. So in summary, I presented two clashes, which was first about the life getting inequality, about money, and about the life being more important than the money, and our team's second clash, which was what would everything give effect to the bigger society, talking about the economy getting collapsed and the medical company. So I presented two clashes, and I'm very proud to propose. Thank you.
As Speaker 3 of the opposition team, I'm to prove that this House should not ban companies from making a profit from life-saving drugs. Let me begin with some rebuttals. The proposition mentioned that the poor won't have enough money to get medicine and medication. They are focusing on secondary effects. This is a primary effect, which again, they are completely avoiding. How will they research, make the test product? How will they know the medicine are safe before giving them to the patient? Again, they mention the government as the only solution without actually telling us where the government is going to get the money from. Where? Please address this proposition. The only arguments so far are poverty and that government should take on yet another burden. That's all. We have mentioned so many beliefs and reasons and as to why these companies need to keep their profits. Profits are essential because they attract investors who fund new medical research. Profits plays a crucial role in attracting investors who fund medical research and development. The money can be used in a lot of ways. Pharmaceutical research is extremely expensive and risky for successful drugs. Hundreds of others fail during tests. These products could often cost billions of dollars, and without the promise of financial return, very few investors would be willing to take that risk. In fact, many new medicines are developed by small startups that rely heavily on the private investment to survive and continue research. The money is needed to pay back the investors so we can continue to make medicine. If pharmaceutical companies were not allowed to make profits, investors would take their money elsewhere to get safer and more rewarding industries. Without the funding, companies would not be able to afford the laboratory, equipment, or scientists needed to create new treatments. As a result, medical progress would slow dramatically, meaning that diseases which could be cured or treated might continue to harm millions of people for years longer than necessary. If a medication is not confirmed by an investor, that medication might harm the people's health or even kill. Moving on to my next argument. Allow me to address some potential concerns from the proposition side. They definitely worry about pricing and how to manage rising costs of the drugs itself for the general public. Now, there are ways to handle this. There are rules that can be put into the place to managing rising costs of drugs while allowing companies to make a profit. Instead of banning profits together, governments can regulate drugs prices and require companies to offer discounts for essential medicines. This creates a fair balance between companies that can still earn enough to continue researching how patients can afford the drugs they need. Regulation, not prohibition, is the smartest solution to ensure fairness and continuous improvement in medical care. This is a long-term solution, not just adding more burdens to the government like the proposition suggests. That way, we can both save lives now and continue creating life-saving medicines for the future. Investors are important. Patients are important. Providing quality care is important. We need to take care of everyone in these groups. And of course, we need to take care of those who are creating these medicines for us. In our world, everyone benefits in our proposition world. All they do is put more burden on the government rather than solutions. This is not about greed or about making money. It is about ensuring safety, security, quality for everyone. Therefore, this clearly shows that we shouldn't ban companies from making profit from life-saving drugs. Thank you.
Is more important than money. Yes, thank you. This is what we are saying. We're creating a world where life is valued. Hence, these organizations should be paid according to what they need. They require these profits to help save lives. There are ways to protect the disadvantaged and to enable them access to such medicine without cutting back on profits. We have already addressed this. The proposition keeps mentioning the gap between the rich and poor. This ignores the fact that most countries in the world are already working on this gap. If not, they have already made it extremely affordable. This is a worldwide effort that has already been addressed. But what they have not understood is that if there's no profit, companies won't keep making new drugs, and then no one, not even the poor, will get help. When companies earn money, they can make more medicine, donate to hospitals, or work with governments to give discounts. The problem is unfair. Prices, not profit itself. So instead of banning profit, we should control prices. That way, everyone can get the medicine they need, and companies can keep saving lives. The idea of asking government to take over and remove profit sounds kind, but it's short-sighted. Governments are already stretched thin, funding hospitals, education, housing. Unfortunately, government supports Support seems to be the one and only solution the proposition has offered. This simply will not work and it is unrealistic. Let's remember, regulation, not removal, is a smarter path. With price controls, public-private partnership, and global aid programs, we can make medicine affordable without killing the drive to innovate. If we remove profit, we may feel morally satisfied for a moment. But what good is a satisfaction when no new cures are being discovered? When the next vaccine comes too late. Saving lives requires compassion and practicality. We, the opposition, need both heart and reason. The proposition, unfortunately, is promoting empty idealism. Therefore, absolutely not.
Honorable Judge, isn't it clear the company should not make profit from life-saving drugs? In our world, justice and fairness exist, and companies are not allowed to get profit from life-saving. This is beneficial because it reasons why life is more important than money, it lowers inequality, and the society won't be destroyed. However, in contrast to this, the opposition team's road is a total disaster. Justice and fairness doesn't exist. Companies make profit from life-saving drugs. Judge, do you think that this road is good? Now, to explain why our road is better than the opposing team's road, let me take the example of COVID-19. So now, the COVID-19 vaccine was free and the poor could afford it. However, let's say the companies made profit with the COVID-19 vaccine. What will happen if we do like the opposition team is claiming? The poor won't be able to afford and protest would have happened. We shouldn't allow companies from trying to make a profit when people are dying. We believe that our road is more better than the opposing team's road because of the following reasons. Now, let me move on to explain the burdens of each team and why we could overcome what the opposing team couldn't. First of all, we stated strong arguments and ideas that helped us overcome our burden. However, what did the opposing team say? The opposition team's burden was to explain how companies should make profit. To respond to this, they stated that companies will then make better medicines and etc. However, we would like to explain what will happen if we do about what if the opposing team is stating. If companies keep making these medicines, the amount of how much medicines poor people can afford will increase. This will only increase inequality and make poor people feel resistant towards the government. In addition, government has a lot of money to support the medical companies. Finally, the opposing team is only talking about the case where the rich is getting the benefits. We should say that poor people need the benefits too, and they cannot get the benefits when they do not buy the drugs. So for these reasons above, I'm more than proud to propose. Thank you.